Hello and welcome back to Study More Hygiene. Today I want to talk about calibrated periodontal probes. So let's talk about some general design characteristics to start. So calibrated periodontal probes is a periodontal instrument that is marked in millimeter increments and used to evaluate the health of the periodontal tissue. So calibrated probes have a blunt, rod-shaped working ends that may be circular or rectangular in cross-section. The function of a periodontal probe, findings from an examination with a calibrated periodontal probe are an important part of comprehensive periodontal assessment to determine the health of the periodontal tissue. These probes used to measure the sulcus and pocket depths, to measure clinical attachment levels, to determine the width of attached gingiva, to assess for the presence of bleeding or pus, and to measure the size of oral lesions. So calibrated probes are marked in millimeter increments that are used like miniature rulers for making intraoral measurements. So let me pop out my probe here. So I have a probe. So as we can see, as said, it has a rod shape and a blunted end. And I'll get that close there. We can see those millimeter markings. So every one of those dashed lines is a millimeter. Those black lines indicate it goes from, it's 2 millimeters, 1 millimeter on the bottom, 1 millimeter on the top. So here's a more detailed picture of that probe there. Again, every dashed line indicates a millimeter, and then that bottom of the black line is a 4, and the top of that black line is a 5 millimeter. So that is our UNC probe is what we actually call this. Is a UNC probe, so you can see there. So they call it a UNC 15 probe because it goes till 15 millimeters. So that's what we call a UNC 15 probe. So the function of a calibrated probe, it's an important tool to obtain information about the health status of the periodontium. So calibrated periodontal probes are used to gather information about the health of the gingival tissues, bone loss to measure the size of intraoral lesions. So a probe in a healthy sulcus, so we'll use our model here, pretend it's a healthy sulcus. A periodontal probe inserted into a healthy gingival sulcus. The space between the free gingiva and the tooth in health, the depth of the sulcus is from 1 to 3 millimeters. So we would take our probe. Let's do it on this premolar here. So we would insert. We're talking 1 to 3 millimeters. So right there, we're about at 3 millimeters. So going across, that's 3 millimeters in health. So a probe in a periodontal pocket shows the probe is inserted into the periodontal pocket. The periodontal pocket is a sulcus that is deepened because of disease. The depth of a periodontal pocket is greater than 3 millimeters. So let's see here how far we can go. So if we take our instrument, hypothetically, if we had a periodontal pocket, we would be going, so that would be into 4, 5, 6, 7, even 8 millimeters we can go down. That's a deep periodontal pocket. And that's someone who's not as in proper health. So I want to discuss some more technique when doing periodontal probing. So let's put our model down here. So as far as technique, we would take our instrument. Let's start with a premolar here. You would do walking strokes, tiny strokes across the tooth slowly making an angle as we reach the line angle. So we would walk back, slowly lean that probe to get an accurate measurement. Once we're all the way into that sulcus, we would lean that probe forward just to get an idea exactly how deep the pocket is. We can do it on this tooth as well. Go, walk the probe, line it up, and walk back. And one more time, we would do these tiny walking strokes across the tooth. And then we would go back. On an anterior tooth, we can do the same thing. Go there, we walk back. And I'm kind of exaggerating that walking stroke a little bit. So probing is the act of walking the tip of the probe along the junctional epithelium within the sulcus or pocket for the purpose of assessing the health status of the periodontal tissues. Careful probing technique is essential if the information obtained with the periodontal probe to be accurate. So what we were doing is called a walking stroke, which is the movement of a calibrated probe around the perimeter of the base of the sulcus or pocket. The walking stroke are used to cover the entire circumference of the sulcus or pocket base. It is essential to evaluate the entire length of the pocket base because the junctional epithelium is not necessarily at a uniform level around the tooth. In fact, differences in the depth of two neighboring areas along the pocket base are common. So again, like we were doing, we would insert our probe and do that walking stroke. And sometimes on this right here, we could go down a little bit deeper compared to right here, which it could be a little bit shallower. So it's important to do short walking strokes so we can identify all the areas around the tooth and chart that. So when charting, each tooth is divided into 6 surfaces. So on the front, we would have the mesial surface, the direct facial surface, and the distal surface. So we would chart all 3 of these surfaces. And then again, on the other side of the tooth, we would have the mesial surface on the lingual, the direct lingual surface, and the distal surface of the lingual. So that would be one site